Hello everybody, this is Dr. Eduardo Beltran. Today we will be talking about a very interesting condition known as mast cell activation syndrome. I have dealt with this throughout the years. It's been a very interesting learning experience on behalf of many of my patients who have mast cell activation syndrome. I would say throughout all the years that I've been practicing as a physician, this has gone under my radar in many occasions, and until I, started learning more about it a couple of years ago. And unfortunately, a lot of physicians don't even know what mast cell activation syndrome actually is. It's this condition known as MCAS, or mast cell activation syndrome, causes a person to have repeated severe forms of allergy symptoms that can affect various different parts of our body, And like the word says, like the condition says, it's the cell that's involved here is the mast cells, And unfortunately, for some reason, these cells mistakenly release too many chemicals, and one of those chemicals that we know is histamine, which ends up causing a series of, signs and symptoms that can be manifested at the level of the skin, the gastrointestinal tract, at the level of the heart, the respiratory tract, neurologic symptoms, It can cause problems such as hives, swelling, low blood pressure, tachycardia. Sometimes can cause a respiratory issue like, difficulty breathing and severe diarrhea. So it's a very mixed it has a lot of different signs and symptoms that sometimes, overwhelms the doctors of what's actually going on, because they start to scratch their heads like, what the heck's going on with this patient, And it's basically, these cells known as mast cells that are just producing excess amounts of histamine. So when I started dealing with patients who do have mast cell activation syndrome, I just really wanted to know what the root cause of this was. And this took me through a very interesting route, because since I'm already a person that works with a therapy known as the Coimbra protocol, I have my own version of it. It's called the LGS protocol. I'm a vitamin D expert. That's one of the therapies that I do utilize in treating many different forms of autoimmune diseases. And I've been doing this for many years now in my home country here in South America, in Brazil. That's where I learned everything in regards to vitamin D therapy, high dose vitamin D therapy. What I can say is that vitamin D can be beneficial in high doses to patients who have mast cell activation syndrome. And the reason why I say this is because mast cells have vitamin D receptors. Let us not forget that every single cell in our body has vitamin D receptors, and mast cells have these very specific receptors, and it's been shown and described in the medical literature that vitamin D can in fact, help in normalizing the excess amount of release of histamine from these cells, okay? And I'll dive into that in a little bit, but I also wanted to understand a little bit more of the genetics. And since I'm a person that works a lot with, genetics, I look at a lot of genes and polymorphisms especially. Interestingly, when I started looking at patients who had mast cell activation syndromes, I found a whole different series of genes that are involved in the whole histamine physiology, biochemistry process. So I really looked down into the genes that are involved in all of this process, and I found a lot of interesting things that today I will be sharing with you. And perhaps this might be a little bit of a light at the end of the tunnel, I guess you could say, that might be opening up a little bit your eyes in regards to how to be able to treat these patients, okay? Now, one thing I want to go ahead and advance and mention is that many of these patients that do have mast cell activation syndrome have what we call as dysbiosis of the intestinal tract. And this dysbiosis can vary from mild to moderate to very severe. They may have a condition known as SIBO, as SIFO. Basically, SIBO means small intestinal bacterial overgrowth, or they might have a fungal overgrowth, SIFO in this case. It might be candida, it might be mold, it might be mold, it might be any form of other fungus as well that's growing in there that shouldn't. So dysbiosis basically means is that it's an overgrowth of some form of pathogenic bacteria. Sometimes it might be a normal bacteria but it's being produced, it's growing in excess amounts that they should not be doing that, right? And then that's where it starts to become challenging. So, as I was saying, I treat a lot of autoimmune diseases, and patients who have autoimmunity sometimes also have what we call dysbiosis, such as SIBO and SIFO, and a condition known as leaky gut syndrome. So, one of the things that I've noticed that when my patients start my patients who have autoimmune diseases, not patients who have mast cell activation syndrome. But before I actually started treating patients who had mast cell activation syndrome, I was treating a lot of autoimmune diseases. And many of these patients who had autoimmunity, such as, vitiligo, such as multiple sclerosis, such as, psoriasis, atopic dermatitis, rosacea, you name it. I have patients who have Crohn's disease, ulcerative colitis, patients who have myasthenia gravis that all are right now in this moment in remission. And that's thanks to the whole high-dose vitamin D therapy that we apply to them and that we give them, associated with an anti-inflammatory diet. And this diet that I apply it's a diet that's basically, gluten-free, it's dairy-free, it's lectin-free, and it's sugar-free. Okay. Sometimes you have to be a little bit more aggressive and perhaps even do a low food MOPS, diet as well. But when it comes to mast cell activation syndrome, you also have to put them on a low histamine diet, right? So it's a very complicated situation sometimes because you're really limiting the amount of food that these patients are eating, because a lot of foods that are low in lectins are high in histamine, or a lot of foods that are low in food MAPs, but are high in histamine. So it becomes a little bit tricky to finding out what foods the person can eat and what foods are low in lectins, low in food MAPs, and also low in histamine. So that's in regards to the diet. So it becomes a little bit challenging here, okay? But what I really wanted to say is that one of the things I've noticed is that a lot of these patients, who have autoimmune conditions, who have SIBO, who have SIFO, have what we call biofilms. And if this patient who has all of this ongoing inflammation in the gut, and they're doing the treatment, they're doing the high dose of vitamin D therapy with the cofactors associated with the anti-inflammatory diet, and they do not get better, it's because they have a resistant antibacterial biofilm. And in this case, you need to use what we call biofilm disruptors, which I utilize a lot in these patients, and herbal antimicrobials. Sometimes a lot of people want to use, conventional antibiotics, such as like rifaximin, or many other antibiotics like the ciprofloxacin or fluconazole if it's the case for a patient who has candida. But the problem with these antibiotics is that they barely touch the surface when you have a very thick biofilm, okay? These antibiotics, sometimes you just do not make it through. And that's when you need to start thinking about using a biofilm disruptor. And there are many herbs that can help you out with that, okay? But before we dive into the genes that participate in the synthesis pathway and the production of histamine, we also have to look at the way how histamine is also stored and how histamine is also degraded. And that's very important because if you do not have an understanding of the genes involved in this whole process, then it becomes a little bit tricky to being able to treat, because sometimes you might have a problem in the degradation of histamine and not in the liberation of histamine, or sometimes you might be having a problem in the liberation or production of release of histamine instead, or sometimes it's a combination of both things. So it's very important to do genetic testing. It's very important to also see what type of dysbiosis the patient has, and it's very important to recognize the possibility that there might be a resistant antimicrobial biofilm. Okay? So let's go ahead and dive into what genes I look at when I do genetic testing in these types of patients who have mast cell activation syndrome, and why it's also important to look at the vitamin D genes and genes that are responsible for the methylation cycle. Why is this? Is because of the following. I'm going to go ahead and talk first of all a little bit about vitamin D and the importance of vitamin D, and then we're going to go ahead and dive into the genes that are responsible in the whole histamine production and degradation process, okay? So first of all, if you do not know this, there are a lot of single nucleotide polymorphisms that are responsible for the vitamin D metabolism. As we all know, vitamin D is made through sun exposure. When we expose ourselves to the sun from around 10 in the morning until around 3 in the afternoon after being exposed to UVB rays. And in the literature, it has been described that if you expose yourself for around 15 to perhaps 30 minutes, depending on your skin color, you can make easily from around 10,000 to perhaps even 25,000 international units of vitamin D. Now, this has been described in the medical literature, if you did not know this. And also another very important thing that you have to know is that vitamin D is actually a hormone, It is not a vitamin. When it was classified as a vitamin back in the 1800s, they made a mistake. It was erroneously classified as a vitamin. It's a very potent immune modulator, and it's not just responsible for bone metabolism. This, I would say, it is the most potent immune modulator that we have in our body, and it's a hormone. And very important to recognize that vitamin D, requirements from one individual to another individual varies, okay? And the Coimbra protocol, which is a protocol that was developed by a physician back in Brazil, discovered that when you start treating patients who have autoimmune diseases and you beat the vitamin D resistance, sometimes some people are born with genetic polymorphisms where these genes, unfortunately, in the cascade of conversion of vitamin D, when you start off making a cholecalciferol, when the skin is exposed to the sun, you make cholecalciferol on the surface of your skin, and then this eventually gets transported all the way to the liver thanks to a protein known as vitamin D binding protein. And in the liver, there's an enzyme that's going to convert cholecalciferol to calcifidiol, and then eventually the vitamin D binding protein is going to take that to the kidneys, and there we will have the conversion of calcifidiol into the active metabolite of vitamin D, which is a hormone known as 1,25-hydroxyvitamin D, okay? So that's the whole process there. There are a series of genes that I look at when I'm looking at not only autoimmune patients, but also patients who have mast cell activation syndrome, because I have found in my practice that 80% of patients who have mast cell activation syndrome also have genetic polymorphisms involved in vitamin D metabolism. I'm talking about my patients. These are my findings. I'm not saying that this is found out there in the literature. I'm talking about what I see with my patients, okay? So it is very common to find patients who have mast cell activation syndromes that have genetic polymorphisms in their vitamin D genes, okay? So I'm going to go ahead now and share my screen here with you guys. And let me go ahead and share here real quick. So let's go ahead and dive in a little bit into the histamine gene physiology. I would like to go ahead and clarify that I'm making this video because some patients who I see, some of my patients, have requested this video, so I can go ahead and perhaps make it a little bit more clear for them, and so they can understand a little bit more what's going on and why it's important to do genetic testing, understand why some of these genes sometimes may be a problem, in order to understand why histamine, the breaking down of histamine, and also the storage of histamine sometimes may be an issue for a lot of these patients who have mast cell activation syndrome. So bear with me, I'll try to make things as easy as possible. So as we see here, before we actually make histamine, we have a substance known as histidine. Here we have an enzyme by the name of histidine decarboxylase, which transforms histidine into histamine. Histidine needs to be bound to vitamin B6 as a cofactor in order to be able to be transformed into histamine. So it's important to have vitamin B6 in order to make histamine. Okay. Now histamine, once it's made, it can go through two different routes. It's going to be stored in specific cells such as mast cells, basophils, platelets, neurons, gastric mucosa, etc., etc. These are the places where we will be storing our histamine, okay, for future release. All right, and we'll talk about this in just a second. Let's go ahead and go down the pathway where it gets broken down. So there are a series of genes that once we liberate this histamine, right? And now this histamine has done its job. We need to break it down because we can't have this excess amount of histamine just circulating around our body, acting upon every single one of these receptors, causing all the excess, activity on these receptors. So the body has a series of genes that will be able to break down this excess histamine. And one of the genes that upregulates an enzyme known as D-amino oxidase, the name of that gene is known as AOC1. This gene, if you're born, let's say, well, let's talk about what this gene does. So this gene gets histamine and transforms it into a substance known as imidazole acetylaldehyde, okay? Now, imidazole acetylaldehyde then goes down and it's broken down into a form that's going to be eliminated through the urine as imidazole acetic acid, right? And that's thanks to another group of genes known as the ALDH family genes that help transform this acetylaldehyde form into the acetic acid form, okay? Now, let's talk about this D-amino oxidase enzyme. This D-amino oxidase enzyme is regulated by a gene known as AOC1, okay? Now, you can have a gene that has a single nucleotide polymorphism, okay? And as you can see right over here, this gene requires copper, calcium, and also water. It's very important for it to be able to work well in order to make this deamino oxidase enzyme that's going to break down histamine into imidazole acetylaldehyde. Okay? Now, you can sometimes be born with a genetic polymorphism where this gene is fully functional, and as soon as histamine hits the circulation, it will be breaking it down the way it's supposed to. But sometimes, some of us, unfortunately, have a slow-acting gene where we do not produce adequate amounts of it to be able to break down the excess amount of histamine, or we make a defective enzyme that does not correctly or adequately, degrade this histamine into imidazole acetylaldehyde in adequate amounts. So then what eventually happens is if you have a lazy or a slow gene that makes deamino oxidase in inadequate amounts, or very little amounts, you basically start getting this buildup of this imidazole acetylaldehyde. Now, when you start building this up, this becomes toxic for the organism, for our body. And guess what? It can actually act upon mast cells and increase the production of histamine. So there you go. Now, there's a feedback, an inhibition feedback, when you start degrading histamine. Once you reach a certain amount, it will have a feedback, inhibition feedback, where it'll say, okay, you've done your job, good enough, let's go to the next step. So then we have imidazole acetylaldehyde, which will be converted into imidazole acetic acid thanks to the ALDH genes, which have a cofactor, as you can see over here, which is zinc and niacin, which is vitamin B3. Okay, so niacin and zinc is actually something very important here. All right, now things that can inhibit, for instance, DAO, things that can inhibit the ALDH genes. Let's go ahead and start off with DAO first. So if you have a lot of ongoing gut inflammation, a lot of ongoing SIBO, SIFO, dysbiosis, patients who are taking, for instance, medications such as metformin if you are diabetic, patients who drink alcohol, you end up having a inhibitory effect on the AOC1 gene, which does not make deamino oxidase in adequate amounts. So things that can be affecting your gut, things that medications or alcohol can be affecting this enzyme being made, right? Now look, we also have, other things that can be ongoing. If you have increased, reactive oxygen species, medications such as, NSAIDs, such as, ibuprofen, aspirin, naproxen, all these anti-inflammatory drugs, which basically inhibit the cyclooxygenase 1 and 2, can actually inhibit also the ALDH genes. So if you're one of those patients who are constantly having, headaches, migraines, and you're taking these drugs, you may actually be causing and promoting an inhibition of these genes, which are supposed to be breaking down this imidazole acetylaldehyde into imidazole acetic acid, right? And as well, if you're one of those patients, or people who like to take, omega-3s, and unfortunately, sometimes we purchase this type of omega-3 that's, very cheap. They're not very good quality. One of the things I always tell people is that if you are using an omega-3, make sure that whenever you open the bottle, you want to go ahead and smell and see if there's not any form of a fish-like odor. Because if there's a very strong fish-like odor, that means that omega-3, that omega-3 is just simply oxidized, and it's not a good quality, and that could actually be bad for you because it's going to be inhibiting these genes, which are known as the ALDH family genes, okay? So bad or poor quality fish oils can be a contributor to inhibiting these genes that convert imidazole acetylaldehyde into imidazole acetic acid. Okay, and obviously, the older we get, these genes also, do not work as they're supposed to. So all of these things that I'm talking about here these are the genes that process histamine that is outside of the cell. Okay, now these genes over here are the genes that process histamine that are inside of the cell. And here we have very important genes. One is known as the HNMT gene. Okay, this was found in the liver, in the uterus, in the placenta, in the brain as well. And SAMI, which is very important, also a cofactor for this. Okay, for upregulating this gene. And this gene transforms histamine into another compound known as N-methylhistamine. And N-methylhistamine will be eventually, transformed into N-methylimidazole acetylaldehyde, and this eventually into N-methylimidazole acetic acid once again, which is going to be eliminated through the urine. But we have some intermediate genes here that also break down this N-methylhistamine into N-methylimidazole acetylaldehyde, okay? And here we have the gene known as MAOB and MAOA, which interestingly are regulated by vitamin D. Once again. And as you can tell, there are some cofactors that are very important here. Here we saw that the HNMT gene has a cofactor known as SAMI. Another thing that, for instance, these two genes require is vitamin B2. Okay, that's very important. It's riboflavin. Okay, sometimes you might be having a deficiency of riboflavin. Sometimes it might be a deficiency in zinc or in niacin or copper. And guess what? If you have these deficiencies, you are affecting these pathways that break down histamine, okay? But then there are other things, other habits and other things that can affect us as well. For instance, if you're a person that loves to drink a lot of coffee, caffeine inhibits this gene, right? The MAOB gene and also the MAOA gene. Now, if you're also a person that has acute high stress jobs, and also it's found that in males, it can also be something that's attributable to them, it's mainly found in males. So these things can actually inhibit these pairs of genes that you're seeing right over here, okay? Now, if we go a little bit further down, once again, like this gene, this family of genes, zinc and niacin are upregulators or cofactors for activating this gene, which transform N-methylimidazole acetylaldehyde into N-methylimidazole acetic acid, right? Now, once again, like I said, reactive oxygen species, use of NSAIDs, oxidized fatty acids, increased age affect this group of family of genes that have difficulty in converting this acetylaldehyde form into the acetic acid form, okay? And once again, acetylaldehyde is toxic for our body. This activates mast cell activation syndromes, and also it causes toxicity in our body, okay? And there's another gene here known as the NAT2 gene. It requires a cofactor known as vitamin B5 in order to transform histamine into acetylhistamine, okay? And things that can inhibit this gene, which is the NAT2 gene, are things like estradiol, people who are taking those anti-contraceptive pills that have estradiol, acetaminophen, quercetin, curcumin, licorice, garlic, grapefruit. These things can inhibit the NAT2 gene, all right? So you have to be aware of these things, okay? Like I said, sometimes you might be one of those women, if you are a patient who is taking birth control, and you're taking an estrogen or an estradiol, and sometimes one of the things that I notice is that they complain that they're getting overweight, because that can be one of the side effects of taking birth control pills, and also they complain of headaches. So that might be a reason why it might be attributed to that, okay? Now let's go to this other pathway where histamine is stored into the mast cells, basophils, platelets, neurons, and the gastric mucosa. Once you have an external stimuli that activates this, and we'll talk about this in just a minute, okay? What are the different factors that can activate the mast cell in order to produce the release of histamine? Histamine, once it gets released, it's going to act upon different receptors that we have in our body. We have receptors such as the HRH1 receptor. This is found in many different tissues, such as smooth muscle tissue, the heart, our endothelium, and also in our central nervous system. So that would explain why many of these patients who have mast cell activation syndrome have symptoms that affect these different tissues, okay? And for instance, the HRH2 receptor is found in our stomach. It increases the production of gastric acid, hydrochloric acid, right? H3 receptors, for instance, they're very important they're found in our brain, in our central nervous system. It helps and also in the production of certain neurotransmitters as well, such as acetylcholine, norepinephrine, and also serotonin. Norepinephrine, as we know, causes vasoconstriction. It can also stimulate the heart, produce tachycardia, right? And HRH4, these are receptors that are found, for instance, in eosinophils. It helps in the maturation and the differentiation of these cells. And also, if we also have these receptors found, for instance, in our bone marrow, whenever we have a release of histamine, it stimulates the liberation and circulation of neutrophils. And also, we know that these act upon, as well, on the mast cells themselves, allowing for chemotaxis as well. So as you can see, these pathways must be understood, and sometimes it might be a deficiency in many of these cofactors that are necessary for these genes to function well. Sometimes you might have a fast gene, or sometimes you might have a slow gene that cannot break down one metabolite to another. So you need to compensate the gene by giving it the cofactors that it needs, okay? Let us not forget that these genes require cofactors for them to function well. And when we are deficient in these cofactors, or supplements, or vitamins, or minerals, or whatever you guys want to call it, I mean, these genes just simply do not work how they're supposed to. And let me just say again, it is our genes that dictate how our biochemistry works in our body, okay? And understanding how these genes behave due to polymorphisms that are present in individuals will give us a better understanding of how the biochemistry of one patient is different from another, okay? Now, one thing I did want to say is that going back to vitamin D, the importance of vitamin D, as you can see over here, I have this diagram showing you a mast cell, and mast cells are also equipped with vitamin D receptors. I did mention earlier that every single cell in our body has vitamin D receptors. So whenever you have calcitrol being made, it's going to act upon that mast cell, it's going to act upon that vitamin D receptor, and it's going to cause a stabilization. It's going to stabilize the liberation or the release of histamine. Okay, and sometimes what happens is that when you are in a vitamin D deficient state, these mast cells are just a little bit hyperactive. You know, they're just anything that just pops in there and just activates it, they just release that histamine immediately. So vitamin D is very important. It has been described in the medical literature as a very important cofactor for being able to stabilize mast cells. Okay. All right, so let's go on to the next diagram. Let's see what we can find here. This diagram, we can finally see here our mast cell, as you can see, okay? And we have a whole bunch of different things that can actually stimulate this mast cell. Here we have specific neuropeptides. You know, there's a whole bunch of them right there. Somatostatin is also one of them. Here we have other substances such as endothelin 1, tryptase, CRH, urocortin, NPs, PTH, bradykinin, super antigens, the complement system, peptides, beta defensins, catalysoledins. We also have certain cytokines, bacterial toxins, and chemokines. All of these, and obviously immunoglobulin E and immunoglobulin G, all of these can activate mast cells for the production and release of histamine. But what I would like to go ahead and mention here is that vitamin D also plays a crucial role in the regulation of many of these substances that can actually activate mast cells. For instance, we know that vitamin D, when we are deficient, we are more prone to making immunoglobulin E that can actually activate mast cells. So when we have adequate amounts of vitamin D in the body, or when you compensate vitamin D gene polymorphism with amounts that are above what we expect in certain people, guess what happens? This immunoglobulin E gets tapered down, and now you don't have that excess amount of stimulation of mast cells. So vitamin D is very important for regulating, IgE synthesis, which eventually is going to have an effect on mast cells as well. Okay, and we also know that vitamin D also regulates the complement system. Here's a very a study that was published in the Journal of Immunology. For instance, you can check I highly suggest you guys look into these studies. They're very important. I think they're very they open up your eyes to seeing that vitamin D is a very important cofactor for regulating mast cells. So we know that vitamin D, active metabolite known as vitamin calcitrol or 125 dehydroxyvitamin D3, suppresses senosal epithelial cells. By the release of C3. So this means that vitamin D regulates complement. And also we know that vitamin D also regulates the production of beta defensins. We also know that vitamin D regulates the production of catalysoledins. We also know that vitamin D regulates the liberation and synthesis of certain cytokines because it makes your immune system go through an anti-inflammatory route. And it also regulates T regulatory cells. Okay. We also know that vitamin D acts upon bacteria. It makes beta defensins and catalysoledins that destroy bacteria and toxins. And we also know that when you have dysbiosis, when you have leaky gut syndrome, vitamin D inhibits the production of zonulin, which are found in the enterocytes. And zonulin is a substance that breaks down those tight junctions. So if you have adequate amounts of vitamin D, you inhibit zonulin, which will eventually allow for a more, healthier gut. Those enterocytes are going to be bound together. They're not going to break down. those tight junctions are going to stay, in where they're supposed to be. The integrity of the tight junctions are going to be preserved. Oh, look at how important this is. We also know that vitamin D also regulates certain chemokines and even some antigens. So, vitamin D is really a very important thing that you must be putting on your patients who have mast cell activation syndrome. At least I do it on my patients, because I know that many of these patients, when I do genetic testing, they have genetic polymorphisms in their vitamin D genes, and also polymorphisms in genes that are in regards to the breaking down of histamine and also in the release of histamine, okay? So that's what I wanted to go ahead and share with you guys. Now I'm going to go ahead and talk a little bit about dysbiosis and SIBO and SIFO. So let me go ahead and get out of here. So once again, like we were saying, all these patients who have MCAS, mast cell activation syndrome, we have to be a little bit aware that genetic polymorphisms play a huge, important impact on the biochemistry of these patients. And the majority of these patients have what we call dysbiosis. And it's this problem it's the dysbiosis problem, the SIBO, the SIFO, that causes so many problems on these patients. And it literally, takes away their lives in some instances, because it becomes such a big problematic issue that they have to be walking around. I know people that have to be walking around with their EpiPen, basically, They sleep with their EpiPen under their pillow. I have a patient of mine, or a person that I know who has MCAS, actually told me that, Dr. Beltran, I sleep with my EpiPen under my pillow. That's not supposed to be happening, okay? So I decided to make this video so I can address, a lot of curiosities, a lot of questions perhaps that my patients might have, or people who are, suffering with mast cell activation syndrome and would like to know a little bit how to go about treating this condition, okay? So here's the thing. Whenever you find someone that has mast cell activation syndrome, the first thing that you need to be doing is you need to get some genetic testing done. And you also need to do some, microbiome testing. We need to see what bacteria are literally growing in your gut, okay? To be able to determine what type of treatment you need to get done. We need to determine if you have genetic polymorphisms of your vitamin D levels, because we know that vitamin D plays a crucial role in gut regulation, microbiome regulation, leaky gut, inhibiting leaky gut from getting worse, okay? It's a immune modulator. It regulates your immune system. It makes your immune system go through an anti-inflammatory route. It also has a key role in regulating mast cells as well, in the release of histamine, okay? And it also inhibits a lot of the factors that activate the mast cell itself, okay? So genetic testing is very important. See how your genes involved in the degradation or breakdown of histamine are. You might have polymorphisms that are, just giving you issues. Another thing that's also important is see if you have deficiencies in certain vitamins, in certain minerals, okay? Just to give you an idea, sometimes you might be deficient in zinc. You might be deficient in vitamin B5, pantothenic acid. You might be deficient in niacin. You might be deficient in copper. You see, these things can be contributing factors for those genes responsible in the degradation pathway, okay? Or you just might be having one of those habits, basically, that you're a smoker, and you just need to stop smoking. Or basically you need to stop drinking alcohol because it just makes things worse for you, Or it might be just, you're one of those people who are just taking, medications for headaches all the time. And NSAIDs can basically inhibit a specific group of family of genes that can't break down the acetylaldehyde form into the acetic acid form of histamine, So these things have to be taken into consideration, okay? Then again, we have to look at how your vitamin D levels are. Sometimes you might be deficient in vitamin D, we need to get those levels up high. And sometimes we need to use the Coimbra protocol, or the high dose, the vitamin D protocol, or the leaky gut syndrome protocol, whatever you want to call it. But you have to get those vitamin D levels really up high in order to be able to compensate that genetic polymorphisms that you have in those genes, okay? And finally, this is the last take home here, okay? If you have SIBO, if you have SIFO, and you've tried taking certain antibiotics to treat these infections and they have not given you any, good positive results, it's because probably you have ongoing leaky gut by the presence of a biofilm. Okay, these bacteria, when they are, under the threat of a certain antibiotic or a certain diet or whatever, they create what we call the biofilm matrix, okay? And this slime of, community of bacteria, basically what they do is create like a shield. So antibiotics don't even touch the surface of these bacteria because it protects them from antibiotics. So sometimes you need to be considering the use of a biofilm disruptor. And we have plenty of different, antimicrobials over there that act as biofilm disruptors, that can break down this biofilm and also not only just give a biofilm disruptor, but attack with also certain antimicrobials, some herbal antimicrobials that are very potent, We have a lot of herbal antibiotics such as oregano oil, berberine, golden seal. We've got licorice. We've got juniper. We have Altornia, Echinacea. We have different types of, antimicrobial herbs that act very potent against these bacteria. But we have to be very cautious because when you start attacking and killing off these bacteria start dying off and they release these toxins. So this is what I want to say. So when they start releasing these toxins, you get this die-off effect. And I had mentioned this before in one of my videos when I was talking about vitamin D receptors blockage. This die-off effect can actually cause a lot of problems because these mast cells have been so hyperpolarized that anything that just touches them just literally makes them go haywire, and they start just producing all this histamine because you've got all this abundant bacterial toxins circulating now in your organism that are making these histamine, making these mast cells just produce so much histamine, okay? So we have to be gradual, we have to be slow, we have to change the diet because the diet that these patients are on needs to be sometimes it has to be an anti-inflammatory diet, and it has to be low on histamine as well, okay? But like I mentioned, it is a multidisciplinary approach. You need to see the genes, you need to see the microbiome, you need to see the deficiencies that the patient has, and you need to correct those deficiencies that those patients have. And that includes also vitamin D. So I use vitamin D in my clinical, in my own clinical experience. I've seen that it helps these patients out a lot. Many of these patients who have mast cell activation syndrome do not only have mast cell activation syndrome, they also have other autoimmune conditions associated with mast cell activation syndrome, because leaky gut syndrome, which is the common denominator in every single patient who has autoimmune disease, also may be present in patients who have mast cell activation syndrome. So if you have a patient, if you are a patient or you're a physician and you're treating a patient who has mast cell, you must consider all of these things that I just mentioned. And biofilms are a big problem for these patients. You have to treat these, okay? All right, everybody, I hope this video, I know it's a long video, but it's highly informative. I think it's going to open up your eyes a little bit in the way how you probably encounter your patients, or if you're a patient, this is something that you might want to consider in showing to your physician, okay? Until next time, this is Dr. Beltran. See you guys. Bye-bye.